Welcome to our free and anonymous HIV blood test information resource. We hope it is a useful first step information resource about HIV and AIDS.
What is the objective of the blood test?
The objective of the HIV blood test is to find out if you are infected with HIV, a virus that causes AIDS. While there is no medication to cure HIV itself, with proper medical support and good lifestyle control of the disease, you can still live a normal life. If someone is infected and has a serious delay in starting treatment, it may lead to a life-threatening condition. If you have any possibility of infection, even an extremely small chance, we recommend being tested for HIV. HIV may be transferred if someone's blood, sperm, or vaginal fluid enters your bloodstream through your mouth, eyes, or open wounds. HIV may be transferred if you have vaginal or anal sex without using a condom. If you are infected with HIV, your immunity gradually weakens. And in most cases, symptoms of AIDS develop after several years. Because this virus increases very slowly in our bodies, having a test immediately after suspected infection is not the best timing, as the amount of virus is still very small and is difficult to identify. Therefore, we need an interval between the time of suspected infection and testing.
When do you recommend getting a test for HIV?
In general, we recommend you wait for at least 3 months after your last possible chance of infection before taking an HIV test. If you take a test at least 3 months after the possible infection date, and the result turns out to be negative, it means you were not infected by that exposure.
How does the process work?
First, please understand that your privacy is strictly protected. We won't ask your name, nor any personal information, except for your mother language or nationality. We will inform the test result only to you, not to your family members, nor to the immigration authorities. However, we cannot issue a certificate of a negative result, as this test is anonymous. We will conduct a blood test, as it is the most reliable way to identify the presence of any HIV infection. The test result is given after performing a series of confirmation tests. There are basically 2 types of tests, a rapid test and a standard test. If it is a rapid test, results will usually be available on the same day. In some cases, you may need to go back in about a week for the test result. If a follow-up confirmatory test is required, the results will be available on a later date. If you take the standard test, the results will be made available on a later date, and you will need to schedule an appointment to receive the results. Remember, to take the test, a reservation is necessary. Please take a moment to pause the video and look at the figure, HIV testing flow chart, as an example of a test process. As a general guide, we recommend you take the HIV test if you are concerned about an event or possible infection. However, if you are still unsure about the test, or would like to find out more about HIV/AIDS, please contact one of the multilingual telephone counseling services. This has been a PiCube production in association with the HIV/AIDS Information Society in Japan.